Pooney was diagnosed with total renal failure just 9 months ago. PD is helping her feel better.
I used to really snap at people for no reason whatsoever. Even at the beginning of PD, when I first started, I was still snapping at people. I'd lose my patience even with my daughter over nothing. As the treatment went on, I don't think I snapped as much. It made a big difference within a month that I was feeling better. And as each day goes on, you do feel better and better. It's just a daily routine. Overnight, you're doing your dialysis treatment in the morning. You get up and you discard everything and you take your medication, and then that's it. You know, being on PD, your kidneys are cleaned out every day, so you're not limited. You know, just at the beginning you are, because you're just trying to adjust to everything. But after that, it's just like normal. I think it's got its benefits, the fact that you still have your social life. If I want to go out with my friends and come back late, I'll get the machine set up before I go out. So you can set the machine up anytime you want to. So it's not like there's a certain time frame that you have to have it set up for. So even if you come home at 4 o'clock in the morning, you just hook it up and you just stay until bed till 12. When they said, oh, you know, the catheter is going to go by your belly button, right? And my first reaction was, oh my God, I can't wear summer dresses. You know, I can't wear jeans anymore because they're going to be able to see it. Or I can't wear a sari because in a sari your stomach shows. And everybody's like, that's your biggest fear? I was like, yeah. I'm not wearing track pants for the rest of my life and big jerseys. But you can't even tell. Like, you can wear whatever you want and you can't tell. It doesn't show it. Because it's just below the belly button. So you can't see it. I have no problems being on PD. And I think that if it wasn't for PD, I don't think we'd be sitting here talking. I don't know where I would be or what state I would be in. But I think PD has really pulled us through all this.
At 4 years old, Joshua Sweet has been on PD for 2.5 years, more than half of his life.
Joshua, the high blood pressure is 200, so we stay ICU for 2 days. Then doctor quickly give Joshua to surgery, yeah, and set the tubes inside, do dialysis. Yeah, just do dialysis for 1 day. Joshua's blood pressure is quickly go down. Right now, I think he is much better for his spirit. He has more activity. Right now, he understands he need to do dialysis. For example, the 1 day I said, I'm tired, I don't want to set up a machine. But Joshua say, no, you need to set up a machine because I need to do dialysis. Joshua told me. Because the dialysis need to do for 12 hours. So at 8:30, so next day, at 8:30, he can disconnect. And we can get ready to school. So I can make a schedule depend on when I need to do hook up the dialysis. Sometimes nurse come to my home. I worry about something I'm not good at. The nurse can help me and teach me. Yeah. Sometimes it's hard, a little bit hard. Yeah. So fortunately, the nurse can come to my home, so I can go outside and I can relax. My son, he started speaking after 3.5 years old. Before he can't talk. Yeah, but after 3.5 years old, I quit my job. Yeah, and I stay home. I read book for Joshua. I bring Joshua go to school more, and I play with Joshua, and he can learn more and more. Yeah, so I'm very happy right now. He has a good life. Yeah.
Pat Roberts is happily retired and living in a remote community. She and her husband enjoy an active lifestyle in BC's interior, hours from the nearest hospital.
I chose this treatment because This is my lifestyle. I couldn't think of traveling back and forth and 2 hours each way. And besides, I have a husband that's, I wouldn't want him to have to live in a city. Well, I wouldn't want to have to live in a city. This is the way we want to live. I couldn't see myself sitting in that hospital 3 times a week when I could do this. I just went, I'm going to do everything I did before, everything. This takes 20 minutes, this treatment, that's all. And it's not hard. Like, it's easy to do. It takes 20 minutes, 3 times a day. In the morning when I get up, I'm having my coffee, I do it. I'm sitting there anyway. And in the afternoon, I normally do it at 2 o'clock. If we're out quadding, I've done it at 3:30 or 4. You know, not very often, but there has been days that we're out there and I go, I'm not going to die if I stay out here for an extra hour. So we do. My dietitian was awesome. She told me what I can have and what I couldn't have, and that's exactly what I did. Because I eat right, everything came back up on its own, because I remember going to the doctor and him saying, do what you're doing because you're doing really well. So that does make a difference. I've always loved to exercise anyway. I've walked all my life, every single day almost, rain, shine, snow, whatever. And I feel good. That makes me feel good. I have my blood done here in Caslow every month, and they send it to Trail. I have to go to Trail a few times a year. When I get to Trail, they look at my site to see how that's doing and check my blood work and talk to me about it. And fortunately, it's always good. We have a trailer, so anywhere I go, we take the trailer. You know, we've been south to Arizona for 6 weeks. We've been 6 weeks to Alaska. We just throw it all in the trailer and do this treatment anywhere. And it's not hard. If you do what you should do, and it's easy.
Anita Yan travels frequently for her work. She chose PD because it fits her busy schedule.
When I first diagnosed, they gave me the choice to pick. That's not difficult because right away I know I still go back to work. I still go back, go on my normal life. So that's why it's easy for me just to pick the PD, that's it. There's lots of benefit that I'm on my independent dialysis because it's controlled by yourself. I'm on the cycler during the nighttime and I only do 1 midday exchange. Like now I'm come to work every day, so I will prepare, my twin bag. I warm it up in the morning and then I wrap it with a thick towel, and then I have all the things I need. If that day I have a long day, so I will do my midday exchange in my office. But if I don't need it, I bring home and then I do it at home. Like you taking your exchange, like people taking their lunch break, their coffee break, that's it. The twin bags is very simple. You just hook it up with your catheter and then hang a little bit high up of the solution bag, and then let it drain out and then fill it back in about maybe 20 minutes. The maximum is 25 minutes. Then the whole thing is done. It's very convenient. You can do your exchange anywhere, inside the car, in the ferry, in the plane. I've been travel a lot. Every month or every 2 weeks, I have to fly all over, like to Montreal, to the States. All I have to do is, place the order, and then the day before I arrive to the destination, I just call to the place that I stay to confirm that all my medications are there. Then it's okay. I have no problem with my catheter because every 3 months I go back to the clinic to have my general checkup. 5 years, I haven't gone into any infection. Touch wood, I'm good.
Wayne Kidd is semi-retired. He travels frequently.